morning. My name is Rachel Petroselli, and I'm president of Children's Hospital of Pittsburgh Foundation, and I want to welcome you to a conversation about the Pittsburgh Study. Before we get started, of course, I have a few housekeeping items to cover. First, I want to remind you to use the chat function that you find on the screen where you can submit your questions. We will definitely have time to answer questions at the latter part of our session. We are also recording today's program, and in the days that follow, you will receive an email link, and we hope that you'll share it with others whom you feel might find this interesting and be excited to learn about the Pittsburgh Study. And you might also be noticing that here in the studio, we are socially distanced, and we have a few of our presenters joining us remotely, and that's intended to help keep us all safe. So now let's talk about the Pittsburgh Study. This is a pioneering research and advocacy initiative to address the health disparities and inequities for children, uncover their causes, and be able to intervene immediately. Our goal is to provide the support our children need to achieve their academic potential, to be healthy and thriving. We know, and we believe, that for decades that follow, what we learn from the Pittsburgh Study will inform cities across our country in ways that help them also dismantle the disparities in healthcare and ensure that all children thrive. We have a great team with us today. I'm excited to introduce Dr. Terry Dermody, our chair of the Department of Pediatrics and our physician-in-chief at UPMC Children's Hospital. We also have Dr. Liz Miller, who is our chief of adolescent medicine and young adult medicine and the co-academic director for the Pittsburgh Study. We have Felicia Savage-Friedman, who's the co-community director of the Pittsburgh Study and also the founder of Yoga Roots on Location. And Dr. Jamil Bay, who's the CEO of Urban Kind Institute and serves on our Pittsburgh Study core team and co-chairs the Policy and Place Committee. Before I turn things over to Terry Dermody, I have a brief video for us to watch, which I hope will inspire all of you.
In Pittsburgh, not every child's story has a fair beginning. Many children live in poverty, lack access to social services, clean air and water, and tragically, Black infants are 4.5 times more likely than white infants to die. But with your help, we can change the narrative so that all children have the ability to thrive. UPMC Children's Hospital of Pittsburgh and a host of community organizations and leaders have come together to launch a landmark initiative to help children, the Pittsburgh Study. Pittsburgh is uniquely positioned to address challenging issues like children's health. We're a city that knows how to roll up its sleeves, come together, and get things done. That's why the hospital, community, and leaders like you have been working to make our suburbs, cities, and neighborhoods better. The hospital's community health programs reach across the region, focusing on those where the need is greatest. Now, we're positioned to do more through the Pittsburgh Study, a pioneering research and advocacy initiative that will address health disparities and social inequities for children, uncover their causes, and address them immediately. And in the decades to follow, the study's results will serve as a roadmap for cities around the country to address health equity and ensure kids are healthy and thriving. It takes community leaders like you to help provide the financial support needed to turn big ideas like the Pittsburgh Study into action. Now, with your help, we can change the narrative so that all children have the ability to thrive. Support the Pittsburgh Study today and join our network of leaders working toward real change.
Well, thank you, Rachel, and good morning, everyone. I'm Terry Dermody. It's just a pleasure to be with you. Grateful to you all for joining us. At Children's Hospital of Pittsburgh, our mission is to provide the best care for the most kids. And of course, we do this through our health care at our hospital, in our city, and throughout our region. but we also accomplish this mission through the discovery, the research that we do. It's in research that provides hope to kids who don't have it now. And this morning, we're going to talk about the Pittsburgh Study, one of our most important research initiatives in our hospital, in our university, and our entire health system. Now, the Pittsburgh Study is focused on determining the biological and social influences of child health and thriving. The study is a longitudinal study in which we plan to follow children from birth until the completion of their childhood. For most children, that's graduation from high school. We also have incorporated age-specific interventions, those targeted at infants and then young children, older elementary school children, and finally adolescents. These interventions are designed to improve just those outcomes we seek to measure, childhood health and thriving. We plan to follow these families for a very long time. And an important concept in the Pittsburgh Study is this is research with people, not on people. And it's the community engagement with this work that's so vital to achieving our goals. You know, it was Yogi Berra who said, you can see a lot by looking. And my corollary is that you can hear a lot by listening. And we are listening in the Pittsburgh Study, listening to members of our community, working with the community as partners in conducting the Pittsburgh Study. Now, Pittsburgh, I have to say, of all cities in the United States, is uniquely positioned to do this work. We have a stable population in Pittsburgh, a superb health system, a commitment to research like no other, and an emerging technology sector that together will enable the children of Pittsburgh to teach us the most important influences of child health and thriving that we can then expand throughout the nation and even the world. We really think in guiding this work that although children make only 20% of our population, they constitute 100% of our future. And this is why the work of the Pittsburgh Study is so important. This morning we're going to try and answer four questions, four important questions. First, what is the Pittsburgh Study? How big is it? How many children will we enroll? The second focuses on community-engaged research. What do we mean by that? And how do we actually accomplish research with people? We'll want to understand a bit better child thriving. How do we measure that? What are the most important determinants? And then finally, how can the Pittsburgh Study diminish the racial disparities in health and thriving that are in our community? And with that as an introduction, I want to introduce my friend and colleague, Dr. Liz Miller, who is the academic co-lead of the Pittsburgh Study. Liz, you've been involved in this type of work for a good long time. And I'm curious how you became engaged in such an important way in the Pittsburgh Study. And what can you tell us more about this work?
Thank you, Terry, so much, and Rachel as well, for the beautiful introduction. And there's really nothing that brings me more joy than talking about the Pittsburgh Study. This June, I will have been in Pittsburgh for 10 years, and truly the most delightful 10 years of my career. All of you listening today know that Pittsburgh is a wonderful and unique community. We are truly Fred Rogers' neighborhood, where we care deeply about each other. It is also considered one of the most livable cities in the country. And certainly when I first moved here, really was under the assumption that it was livable for everybody. But it is really our community members, our community partners who have taught me to pay attention and to pay attention to the inequities, and that Pittsburgh is not always livable for everybody. And so I want to pause for a moment and ask all of you to think with me. Do you think Pittsburgh fares better or worse than the national average when it comes to rates of children with asthma? And if you answered worse, you're correct. So in Pittsburgh and in our county, our rates of childhood asthma are about 11% compared to 8% nationally, an indication of the continued concerns around ensuring clean air and clean water for all of our children. So one of the questions that Terry posed is, what is the Pittsburgh Study? And so I want to share with you what the Pittsburgh Study is about in a few minutes, and first talk about how the Pittsburgh Study works, and then describe some of the developmental interventions. So the Pittsburgh Study is what we call a collective impact, in that there are three kind of interlocking aspects of the Pittsburgh Study. This is truly community-partnered research, and in a moment you will be hearing from my co-lead and friend Felicia, as well as Jamil Bay, about their role in the Pittsburgh Study. We have age-based positive health interventions that I will describe in a moment. We have a long-term observational study. As Terry indicated, we are following families who are part of the Pittsburgh Study community all the way through their child's adolescence. And we have cross-cutting scientific committees, which I will describe. So the age-based positive health intervention. So we have 5 developmental cohorts: pregnancy, the early childhood from infancy into pre-kindergarten, the early school age focused on kindergarten through 3rd grade, middle childhood, 4th, 5th, and 6th grade, and then adolescence, both middle school and high school. And in each of these interventions, we are focused on thriving. So for healthy pregnancy, we are focused on listening to people who are pregnant about their experiences with what would support a healthy and thriving pregnancy. With the early school age cohort, we listen to parents and work on strengthening the parent-child relationship as they prepare their child for kindergarten. The early school age cohort is focusing on what we call one of the 3 R's, and it pulls on best practices from across the country. The first R is racial equity, the second, relationships, and the third, reading, with the goal of ensuring that every child is reading proficiently by 3rd grade. The 4th, 5th, 6th grade middle childhood cohort focuses on bringing restorative practices to strengthen a child's connectedness to school, to positive school engagement. And then in the adolescent years, we focus in middle school on supporting children who have been exposed to violence through trauma-focused support groups, and with our high school students working on a racial and gender justice curriculum where we support young people to be leaders and transformers of their own communities. And then, in addition to these positive health interventions, which taken all together, we will be probably following about 15 to 20,000 children in the Pittsburgh Study. We also have cross-cutting scientific committees. These cross-cutting scientific committees include data accessibility. We are firmly committed to sharing all of the information that we collect together in the Pittsburgh Study with our community members, policymakers, and practitioners. Our health services delivery core is focused on the delivery of high-quality care and making sure that our health services are trustworthy for all children and families. Our policy and place group, you'll hear a little bit more about from Dr. Bay in a moment, focuses on neighborhood-level transformation, and the Healthy Environments and Strong Bodies group focuses on environmental justice. Now, together, what is unique about these scientific committees is every cohort has a professional scientist and at least one community member as the scientific lead. Every committee has greater than 50% community members as part of the science, and that ensures that we are truly doing community-partnered research. And with that, Terry, I'm going to turn it back to you.
Liz, thank you. I have to say, every time I hear you talk about the Pittsburgh Study, I'm inspired, and so grateful to you for taking such an important lead role in conducting this work. So thank you. I want to turn next to my friend and colleague, Felicia Savage Freeman. Felicia is the community co-lead of the Pittsburgh Study. And Felicia, I wondered if you would tell us a bit about your interest in this work, what drew you to this project, and what do you hope to accomplish in your leadership of the Pittsburgh Study?
Thank you, Terry. I'm just honored. Thank you for asking me this question, and I'm just so full right now. This is really emotional for me. This Pittsburgh Study has extended this precious opportunity for me to bring my full self to our community. And my full self is me as a Black mama and an anti-racist Raja Yoga teacher and trainer. As a Black cisgender female mama who was born in 15219, which is the Hill District, and raised in 15206, Lincoln, Leamington, East Liberty area, I have had the blessing also of raising 2 Black children to be thriving and self-realized adults in Pittsburgh. And for many years, I have worked in health and wellness in Pittsburgh since I was a teenager. So I'm gonna say it's over 40 years. And I've sincerely committed to other Black and brown mamas being able to tell the same story as I do of their children becoming thriving adults. A pivotal moment for me in my work in Pittsburgh was with Liz. She and I intimately worked together in 2015 at Schumann Juvenile Detention Center while I was teaching integrative Raja Yoga sessions to the youth and the staff at Schumann. And she witnessed intimately and valued my curriculum to hold vulnerable conversations about all of us having personal agency through the Raja Yoga practice, and how I was able to hold discussions about violent systemic oppression, especially racism, as it is in all of our lives. As community co-lead, excuse me, I bring this anti-racist and anti-oppression perspective with the foundation of unconditional love to our meetings in any spaces that I'm in. And we are consistently practicing and holding these precious and vulnerable spaces for each other because of the statistics of Black and brown families and children thriving in Pittsburgh are so violent and heart-wrenching. So for a moment, I would like to ask permission of our audience to share, and this will probably be trauma-inducing for some of us. I know it is for me. This is intimate. So I need you to really take good care of yourself as I share this and as I read it, because it's difficult. So just holding space for myself right now, and holding space for others who this may be traumatizing. And so I'll read it. The rate of death among Black female babies is higher in Pittsburgh than 70% of other cities in the country. So I just want you to breathe through these words and notice, how does it show up in your body? Just noticing. And again, take good care of yourself. And I intimately understand this statistic because in 1963, I was born a Black female baby in Pittsburgh. In 1990, I birthed a Black female baby in Pittsburgh. This statistic is unacceptable. It's more than unacceptable. And part of our practice with the Pittsburgh Study is to bring community together to address this statistic. So that this may be our history, but may not be our present, but no longer be our present, and definitely is not part of our future. We all know that racism is at the root of this statistic. And I am honored to come together with other community organizers and organizations, researchers, and academicians within the Pittsburgh Study. And as you see, there's a small representation of the community organizations that are coming together. This is not an exhaustive list. And as Liz shared with you, we have age-based cohorts that share leadership as co-leads. So we have community co-leads as well as scientific co-leads and community organizers. The Pittsburgh Study's community coming together early in the development of the Pittsburgh Study created shared principles, which as an anti-racist organizer, I was just so excited to see, because this was before Felicia. And to see that you're probably several of you have signed off on this shared commitment in terms of agreements. In the organizing community, we always bring in shared agreements or ways, and these are ways of us being in right relationship with each other and being able to hold each other accountable across these principles. And so some of these principles that really fall on my heart are, for example, keep learning, listening, and expanding the table, building collaborations and breaking down silos. And probably the one that's most close, and the reason why that I was really excited to be a part of the Pittsburgh Study, was research with versus research on. I've worked in enough research projects in Pittsburgh for over the last 30 years of my working life, and all of them have been research on. I'm excited about us really continuing to explore, drill down, and be critical lovers of the systems that we represent, and really drill down into what does it mean to have research with in collaboration. And us doing this drilling down process in terms of research with and working with collaboratively with community members and university community staff folk, it has helped us to redefine and refine what child thriving actually is. And at this moment, I got to give a shout out to my sister, Val Chavis. She's the first community co-lead who really set the stage for me to be in this position to bring the anti-racist framework. So here, specifically with the Pittsburgh Study, us working together and having these shared principles as almost like rules and regs of being together. Also, it holds us accountable to the families that we serve, and families that are with the Pittsburgh Study get to choose their intervention programs. And them choosing and having interactions with the community organizations, as well as the researchers, and having these shared principles up front and center, has us to have much more reciprocal relationships. So relationships of accountability, unlike I've ever experienced in my work environment in Pittsburgh ever. Something that I'm excited about in terms of community members being financially compensated for their time with a more than living wage for their time is another reason why that I'm just honored to be a part of the Pittsburgh Study. And in wrapping up my piece here, the Pittsburgh Study's focus on continually inquiring and developing and refining ways of dismantling systemic racism on the interpersonal level as well as the systemic level is why I'm excited and honored to be a part of the Pittsburgh Study. I see us actively dismantling this violent statistic that I shared with you about Black female babies in Pittsburgh. And we do this through honoring each other's humanity, person by person, meeting by meeting, retreat by retreat. Again, all in an effort that Pittsburgh Black and Brown mamas can all realize their dreams of raising all of their children to become thriving adults. So Terry, I know I was a little bit long-winded here, but I think I answered your question. So back at you. Thank you.
Oh, Felicia, you were perfect. Thank you for sharing with us. Thank you for focusing our lens on that which is most important. We are so grateful to have you co-leading the Pittsburgh Study. Thank you. It's now my pleasure to introduce my friend and colleague, Dr. Jamil Bay. Jamil is the CEO of the Urban Kind Institute in Pittsburgh. And Jamil, I wonder if you could tell us maybe a sentence or two about Urban Kind, and then share with us what drew you to the Pittsburgh Study and the important work you're doing with child thriving. Jamil, thanks for joining us.
Thank you, and good morning, Terry. So I have a personal commitment to this work and its connections to thriving. So the Urban Kind Institute, we call ourselves a think and do tank. You know, our mission is to eliminate barriers to family thriving in overburdened and under-resourced communities. And a lot of our work, you know, is around connecting communities to resources. Being that connector, you know, I was born, you know, like Felicia, I'm a Pittsburgher, born in born at the Southside Hospital, grew up in Belts-Hoover, went to the city schools, you know, and came back, and this is my work here in this city. And so in this space, the relationships that I've accumulated with residents, with people, has helped to connect me and make me a valued and trusted partner to connect and bring resources in. And so our work, you know, removing barriers to thriving, on the one hand, okay, that's a no-brainer, but what is thriving? And how do I understand that? So let me just pause for a few seconds just to give our viewers a chance to answer that question. How do you define child thriving? If you were to jot something down in your head as, okay, child thriving is, when you think about your own children or your grandchildren or your nieces and nephews, you know, whether you're a farmer in Washington County, whether you're an immigrant family or a refugee family, whether you're a native Pittsburgher, what does thriving mean to you? And so we quickly realized, and it's not the same. You know, we have a general notion, and, you know, there's a dictionary definition. So we worked with some researchers from the University of Pittsburgh School of Social Work to elicit input from stakeholders throughout the community to come up with this working definition. And so in the Pittsburgh Study, and we've adopted this in Urban Kind, you know, child thriving, it's well-being across key domains, including physical, mental, cognitive, and social health. Okay. And then that leads to strong minds and bodies, a positive identity, and these feelings of self-worth. And so if we imagine thriving, you know, even still, that has some context in individual communities and families. And so interactions with caring families and relationships, vibrant communities, and healthy environments provide safety and fun and happiness that are essential to support child development and thriving. You know, and so we also know that these larger social and cultural factors, including equity, inclusion, justice, these are integral to shaping a child's well-being and future outcomes and how a child sees himself thriving or herself thriving. What does that mean? What can I be? What can I do? It's from these local factors. And so when we set out to define it, you know, we also needed to well, how do we measure it? What's that mean? And so our work, we created this a rating scale from 0 to 7, and it's a continuum. It's not a judgment. It's not punitive. And in this child thriving matrix, we ask, where is your community in these key areas? So we have a list of questions that we ask people, examples like access to play spaces. Where is your community? And so we're not telling you what's good or bad. We're just saying, where do you think you are from what you need and how you see thriving? And so we measure what matters, and with that data, we then have evidence. Okay, so and a core tenet of this Pittsburgh study is research. So we need to be able to collect, synthesize, and analyze the data to be able to learn from it, and then to use that to empower change. And I think every speaker said it, and because this is core for us, we use that data and that power to empower change with communities. We're not telling the communities what their goals and priorities are. And so in this data we're collecting, we're measuring it from their perspective and then using that. And so this is not sitting in silos at the academy just for folks to write and advance their CVs through journals. We're taking that data and we're putting it to work with communities to remove the barriers that they see in their space and in their neighborhoods. And so the Pittsburgh Study website makes data readily available to inform policy and practice, not just at Children's or the Urban Kind Institute, but community organizations throughout the region can use this data. And so by having this community data hub, we can learn important lessons of what works to improve child thriving and finding bright spots. So Terry, I said I can dig in a little bit more about some bright spots, or we can wait until we get to the products. I don't want to take up too much time, but I think it's important here that we focus on, we are working to empower communities to be partners in this work, because ultimately, we're not doing this for them. We're not doing this to them. We're doing this with them.
Oh, Jamil Bay, that was terrific. Thank you. And let me express gratitude to Liz and Felicia and Jamil. And Rachel and I have a couple of questions for you all. And let me start, if I could. Felicia, I wanted to ask you if you might share a story, or even two, if you have them, about children and families who have been influenced by the Pittsburgh Study. Tell us how this work has changed their lives.
Thank you, Terry. Yes, I am. As a matter of fact, I do have two stories. So one is from a community member who shared their experience working with the Pittsburgh Study and helping to distribute the Family Strength Survey. So I'm quoting the community member verbatim. My first involvement with the Pittsburgh Study came from being involved in the local family support center. I attended a retreat that was such a magnet to get involved and do more with the Pittsburgh Study. Later, I was given the opportunity to disseminate surveys, which is the Family Strength Surveys, to the community. Some of the participants look forward to completing the surveys weekly. This is a way to have their opinions heard. Regarding the newsletter, it's the Pittsburgh Studies newsletter with so many resources along with important information and ways to be involved with an organization that cares about families' feelings, shared ideas, and what they believe is important, education as well. The survey gives a sense of belonging to an organization that allows your point of view to be considered. And so my next story is about how we as the Pittsburgh Study pivoted during COVID. I don't know where that came from, COPAC. Maybe it's COVID packing up and leaving. I don't know. But when the pandemic stay-at-order occurred, some of the community partners asked how we were going to support their communities. They needed to get food and supplies out to their families. We developed the Family Strength Survey in collaboration with public health, social service, and community partners, organizations like the Allegheny County Health Department, Department of Human Services, Urban League of Greater Pittsburgh, United Way, Urban Kind Institute, Latinx community organizations, and the Neighborhood Resilience Project. And it was all in effect to have important questions that we needed to ask to make sure families had what they needed to support their children to stay healthy and thrive during these tough times. Some of the topics we have worked together on with our community partners is to find solutions of unmet needs for home food delivery for single parents through the United Way, unmet mental health needs with the Allegheny County Department of Human Services, and uncertainty about COVID-19 testing options with the Allegheny County Health Department. So those are my two stories to share of our successes. Thanks, Terry. To you.
Thanks, Felicia. Appreciate those stories. And Jamil, if I could ask you a question. Toward the end of your remarks, you alluded to bright spotting. I find that a fascinating concept and wonder if you might tell us more.
So bright spotting as a tool, it allows us to look beyond predictors of outcomes to find out what's really happening at the neighborhood level. So let me give you an example. So because it's only when you look across the city region, okay? When you look at the region, we all have bad air quality. And we can use that to make some predictions about health outcomes. But we can go a little bit deeper and add other layers like income, housing, race, access to healthcare, access to transportation. And we can make even better predictions. But we know that predictors are not determinants. And this is where bright spotting comes in. So we take this map of the region and we look at these layers that I just mentioned, and we say, okay, we can target hot spots of, let's say, asthma. And we track the data and we see, yes, look, we're seeing lots of hospitalizations and we're seeing lots of kids missing school because of asthma flare-ups in these spaces. But then there are some spaces that don't have the same rates of asthma hospitalization or of missing school, but they're exposed to the same things and they have the same predictors. So when we dig into the neighborhood level, let's go in and find these bright spots to look at what's happening there. Is there something that we can lift up? And so in one project that where we did this, we looked at comparable neighborhoods that had the same sort of makeup, same demographics, same kind of housing stock. And because we are researching with and have relationships with people in those communities, in those neighborhoods, we're able to get a little more intimate in our question asking, and investigation. And so what we saw in neighborhoods that didn't have the same high hospitalization rates, one of the differences was the stormwater management, that these houses had drier basements. And with the drier basements, they had less mold in the house, so less asthma triggers. All other things being equal, better stormwater management and better outcomes for kids. And so when we're thinking about the intersection of all these challenges that kids face, we can look at that. And now this is not, though it's a public health issue and a concern, this is where we now go into relationship with Alcosan and PWSA to think about, hey, how do we better manage the stormwater? How can we as community advocates think about that as our challenge when we're looking at child thriving, but here's a stormwater management issue that impacts that. And so through this lens of bright spotting, it allows us to do that. Another example, in the community of Hazelwood, comparing that community to other neighborhoods in the region. We know that, as Felicia said, Black female children in particular, but Black children at large have a relatively high infant mortality rate to other cities. But we also know that that's not uniformly distributed. We looked at Hazelwood, which is a very low rate compared to other similar types of neighborhoods. And so by being in relationship, we can go into Hazelwood and start, what's happening here? What's different here? And there's a specific cultural thing that's happened in Hazelwood where two women who are associated with a program running out of a church take a special interest in teen pregnancy and engaging those parents and bringing those parents into conversation and relationship with them and providing support and conversations and food and other services that has helped to reduce that. As a mitigation thing, we need to tackle these issues across the region, but that's something small, relatively inexpensive, that we might be able to use that in other neighborhoods by sharing that as a best practice, but that was revealed through bright spotting.
Jamil, the depth and breadth of your talents never ceases to amaze me. We go from stormwater management to teen pregnancy, seamless in the transition. Thank you, Jamil. Let me turn to Rachel, who I think also has a couple of questions for us.
Thank you, Terry. And I, too, could hear Jamil talk about bright spotting for a while. There's so much to learn, and he's so good at talking through all of those examples and helping us understand these differences and opportunities to focus on where things are going well and where families are thriving and how we can learn from that to scale it to other communities where that's not the case. So this question is for you, Liz. We've had the great opportunity to hear Felicia talk through the examples of specific families that were impacted through the Pittsburgh study. Jamil talking through the bright spotting and other ways data is informing our work. Maybe go back to that 60,000-foot view and how is the Pittsburgh study fulfilling its vision, and what are you already observing of the power of the Pittsburgh study?
So I opened by sharing that talking about the Pittsburgh study brings me so much joy. And I hope that all of you are picking up on this concept of collective impact, the idea of research when we all come together, right, in this collaboration, that we can really make a difference. But the other sort of piece of this puzzle is a focus on outcomes like thriving, right? And you heard Jamil talk about the ways in which we've really tried to create a whole series of domains of measurement around thriving. And it has to do with the statistic that Felicia shared with you that is heart-wrenching. We all recognize that maternal and infant mortality in our region is truly an unacceptable rates. And at the same time, focusing on preventing babies from dying is an incredibly low bar for us. And, in fact, we call this the Raising the Bar session for a reason, right? This is really setting our North Star at imagining, visioning around a thriving, flourishing community surrounding children where we actually center their health and well-being. And we can actually measure flourishing and hopefulness and connectedness and collective impact. These are measures that really help guide a vision that is really one of audacious hope. And so really that is truly what brings me so much joy about the Pittsburgh study.
Well, I appreciate you sharing that with us. And being that I represent the Children's Hospital of Pittsburgh Foundation, I'm curious if you could share how philanthropy makes a difference in the work.
Thank you, Rachel, for asking that question, because certainly we all recognize, and certainly as a division director in a children's hospital, I know no money, no mission, right? We certainly need the resources to do this work. So there are a couple things I want to point out. One is that you heard Felicia talk about equitable compensation for community members. We have structured the Pittsburgh study in a way where community members are actively involved in our team science. That means that we are very intentionally listening to community members about what makes a difference for them and how their involvement in the Pittsburgh study helps them in their work and in their career aspirations. And so we're being very intentional about workforce development. And so that philanthropic support is vitally important for us to be able to truly do this work with intention with our community members. But there are other smaller ways in which philanthropy makes a difference. And one of my favorites recently is with the philanthropic gift, we were able to purchase toys for the early childhood cohort. And historically, the research team have been using toys as part of the intervention when they visit children and families in their homes. And then they, at the end of the session, have to take the toys, disinfect them so that they can then move on to the next home visit. And with this philanthropic gift, we have now been able to purchase toys so that we can actually leave the toys with the child and family with each home visit. Similarly, with our early school age cohort, they have identified some of the best children's books in the country, and philanthropy then allows us to purchase those books for every family involved and part of our Pittsburgh Study community.
That is beautiful, and I love that the philanthropy enables the opportunity to leave just even a small token or gesture for recognizing the time spent both by the family in that moment and by the Pittsburgh Study representative. And I think that that's fabulous. Thank you for sharing that. Oh. My last question I will direct to Terry. And Terry, we heard at the beginning that this was really a vision that came from you as you looked at coming to Pittsburgh, and saw the great opportunity here and the unique assets we have in the community and a place to make a huge difference. You needed some angel investors, I would say, to get this idea off the ground, because the Pittsburgh Study is largely dependent on philanthropy. Could you take a moment to talk about the impact those seed gifts brought to the work and what we will need for the future?
Well, thank you, Rachel. You're incredibly kind. I would say the ideas for the Pittsburgh Study were owned by many as we developed the concept that if we could just thoughtfully, working with our community, follow children, we might learn about determinants through just those strategies that have been described that influence child health and thriving. But at its very beginning, when the Pittsburgh Study team consisted of 12 people meeting in a room every couple of months to try and plan this study, we really did need angels. And I would say our first angels, the angels at the front door, were the Shear family, who gave us our initial grants to enable us to have our first retreats, hire our first administrative lead staff, really begin to develop a web presence for the Pittsburgh Study. All of this now, almost 4 years ago. And then we soon thereafter received a wonderful grant from the Grable Foundation that enabled us to really begin some of the intervention work that we started right before the COVID pandemic launched. And then I have to say, we're most grateful to the Children's Hospital of Pittsburgh Foundation, Rachel, you and your leadership team for providing for us $5 million from the Master Trust to really launch the Pittsburgh Study rocket into orbit so we can make those kinds of observations that will truly make a difference. And I realize that gift represents the contributions of truly thousands of donors over the years who provide support because they believe in us. They believe in the work that we will do will improve the lives of children in our community. And for that, I'm incredibly grateful.
Thank you, Terry. And I want to be respectful of your time today and for the attention you've given us and participating in this conversation about the Pittsburgh Study. And I want to thank Terry, Liz, Jamil, and Felicia for your great work, and everyone who joins you in making the Pittsburgh Study a success, because you truly are changing the trajectory of children's lives. And we have so much to learn from the Pittsburgh Study that will make a difference in the future. I hope that you will consider joining us for our future Raising the Bar sessions. We have 2 coming up later this spring. On April 22nd, we'll feature our team from the Rehabilitation Institute. And on May 25th, we'll have our team to talk about our cancer program at UPMC Children's. You have been wonderfully supportive of our endeavors at UPMC Children's, and we couldn't do this work without your help. Being a top children's hospital in the country and really striving to provide excellence in patient care, and all that we do in teaching and research is something that's made possible because we have donors in this community and abroad that invest in what we're doing. So thank you. And if you have an interest in getting involved in the Pittsburgh Study, I hope you'll reach out to Michael Silva to learn how you can roll up your sleeves and become a participant in the Pittsburgh Study. And if you have an interest in wanting to financially support the Pittsburgh Study, which I do hope you do, we have a lot of work ahead of us, many years to engage in this work together, and it will take a community that's supportive of that together. So please reach out to my colleague Alana Kalesa if you're interested in learning more. Again, thank you for being with us today and for all you do that makes it possible for us to care for the children and families, not only regionally, but improve their health globally. Thank you.